Okay, good. Okay. We'll go back here. Remember, we have the brachiocephalic. We have the left common carotid. And we have the subclavian, left subclavian. So, the veins. The veins run right alongside the arteries. So you only really have to learn half the stuff. If you know the artery, you probably know the nearby vein. So, we can quickly figure out which is the brachiocephalic vein. Here's the brachiocephalic vein. Right, left. We can sit there and go, okay, common carotid. Here's the right common carotid, left common carotid. And then, of course, we have the jugular veins. Internal jugular goes into the skull, or actually comes out of the skull. External goes external to the skull. Internal, external, internal, external. So those are the jugulars. Okay, the vertebral artery, the vertebral vein. We don't have the vertebral vein on here. The artery. We go to the subclavian, the very first branch. After the common carotid, the next branch is the vertebral. This goes into the vertebrae. Weaves into the vertebrae, supplies it with blood. The vertebral vein, it's not on here, so we don't have a vertebral vein. Then we have the subclavians. All right. We have the subclavians here and here. They go under the clavicle. Subclavian, subclavian. Now, okay, note this vein. Correction, note this artery. It extends. It goes here. It has multiple branches, but it kind of extends all the way down to the forearm, where it splits. As it goes, it changes names like a side street. It just changes names like some streets that constantly change names. It's the subclavian here, underneath the clavicle. It's the axillary here. It's the brachial here in the brachia. It splits into the radial and ulnar. So it's subclavian, axillary, brachial, radial, ulnar. That's that artery. The veins, guess what? The veins go right parallel with it. So, that's the arteries of the arm. Okay, we'll go down here, check out the aorta as it follows down. Back here behind the heart, it's the thoracic aorta. Then it comes down into the abdominal aorta. Once it crosses the diaphragm, it changes names to the abdominal aorta. Now, at the abdominal aorta, it's got a few things. It's got here the celiac trunk. It branches out, creates a celiac trunk. The celiac trunk has a hepatic artery that goes to the liver. There's a hepatic vein that comes from the liver. It's got renal arteries that go to the kidneys. Here, this one's better. Renal arteries, renal veins to the kidneys. And so those are the hepatic arteries, hepatic veins, renal arteries, renal veins. That's the celiac trunk. Now, if we follow it down a little bit, we have the superior mesenteric. Okay, this is on this model. It's a little one, sticks out there, comes straight off the artery, and this supplies the blood vessels to the upper part of the abdominal organs. There's the inferior mesenteric artery. It comes down off of here. Now, counterintuitive. The gonadal artery goes to the testes. You'd expect testes are way down here. You'd expect an artery down near there. No, the gonadal artery, because the testes started inside the abdomen and descended, it's this large artery that extends down. There's the left one, here's the right one. The gonadal artery is this weird one that goes really far. That's the gonadal artery. Then we can move down here to the iliac. Okay, the aorta splits into the iliacs. We've got the common iliac, right common, left common iliac. Now the iliac goes, the internal one goes back here, goes posterior, it goes back to your butt. Internal, back to the butt. External goes down to the legs. Now, note the veins follow with it. Internal iliac vein, they follow with it. Now, as they go down, Once again, just like the arm, this thing changes names. Goes down here to the femur, it's the femoral artery. Goes here past the popliteal, it's the popliteal. And then it splits to become posterior tibial, anterior tibial. So basically, it does the same thing the upper arm does. It's common iliac, external iliac, femoral, popliteal, posterior tibial, anterior tibial. And that should be all the human blood vessels and human heart for our class.